Earlier this year, we launched through Age Diagnostic Laboratories, which is the international consortium of labs from all over the world, standardising protocols, procedures, reports, reference ranges, and protocols for anti-aging medicine laboratory testing. And my job with the field of anti-aging medicine has been to try and bring some level of standardisation to the way that laboratory diagnosis happens for integrative medicine and anti-aging medicine put together. So as such, I am privileged enough to come across some of the best technology around the world. And you'll get to share some of my opinions about technology that we've hand-selected, some from Europe, some from America, some from Korea, some from Australia, some from all over the world. And we have, for the first time, put everything under the one roof. So it makes it a lot easier for you to be able to test your patients from A to Z in the field of anti-aging medicine. And along with that, a proper anti-aging laboratory should be able to offer you reference ranges that are age and gender corrected, because it is crazy giving you the one reference range, say, for growth hormone for a 90-year-old versus a 20-year-old being the same reference range. And more importantly, our comments are based on what we teach at the Fellowship of Anti-Aging Medicine. I run the fellowship together with Dr. Pam Smith from the US in Australasia and in the US, and it is a proper fellowship. I was involved at Swinburne University, being the first tertiary campus in the world to set up a postgraduate medical course in the field of anti-aging medicine. So let's move on. My overview, first of all, is going to give you a combination of the two together, both Professor Moon's area of expertise being the genomic testing, and I'll give you an understanding of what you should be looking for when you're ordering genomic tests, because this is an area of the future, and indeed you're going to get bombarded with the omics. But I'll also give you an understanding of some of the conventional tests that are currently available. The whole process is about ageless health. One of the key concepts I want you to focus on is the field of integrative medicine. This is a field of healthcare that focuses on patients' biochemical individuality, metabolic balance, ecological context, genetic predisposition, and lifestyle patterns are all taken into account when we're assessing a patient. So, with the field of anti-aging medicine, there are a number of biomarkers that we would end up looking at. First of all, you've got the functional ones. Now, there's machines out there like the Hock machine or the arterial stiffness machine. There's a number of tests that you can do to identify one's functional levels of aging. Or as Mr. Johnson said before, the ability to gain flexibility. It's not just exercising to gain muscle mass, but it is also a matter of getting that flexibility. And yoga, indeed, is one of the best ways of maintaining that level of flexibility, because we lose flexibility as we get older. You could also do skin biopsies. In Australia, for example, where we have the highest per capita ratio of melanoma, thanks to the ozone layer being thin over there, thanks to all of you contributing to that problem. And, of course, the tests that you would be used to from conventional medicine are the molecular serum assays, there's urine assays, there's salivary assays as well. But more importantly, of late, we now have the ability to accurately look at one's genomic testing. And you will see here that it's not a matter of just identifying what your genetic predisposition is. That is only giving you part of the picture. So before you decide to go into genomics, do a bit of research. There are labs out there offering genomic testing, so-called for anti-aging medicine. They offer you a number of SNPs or genetic predispositions, but they leave you there. They leave you hanging, saying, oh, well, too bad, you've got the Alzheimer's gene, you've got the prostate cancer gene, you've got the cardiovascular gene. That sometimes can be detrimental to your patients. Put yourself in their shoes. Do you really want to be preoccupied the rest of your life worrying about Alzheimer's? Ones are coming on. The first time you're stressed and you've misplaced your keys, you're going to start wondering, oh my God, Alzheimer's is here. As one of the psychiatrists once said to me in Melbourne, he said to me, I wouldn't worry about misplacing the keys. It's when you don't know what the keys are for, that's when you've really got a problem. Now, with anti-aging medicine, there are two types of aging. And ultimately, this will reflect on the way that you practice anti-aging medicine. We have normal aging or accelerated aging. Okay? So our scope is to decelerate the process of accelerated aging to bring one back into the normality of normal aging process and to slow that as much as possible. All aging and aging-related diseases consist of inflammation, depletion, wear and tear. So I'm chunking it down for you to understand the basics, the core fundamentals of what we teach in the fellowship, but also how we correlate that with the diagnostics. As a biochemist, I like to chunk it down and look at what are the overall treatment concepts that I have to face. At a DNA and at a cellular level, I'm combating glycation, inflammation, oxidation and methylation. These are terminologies you must learn and become fairly familiar with, because they're all fairly simple to correct once you know how to. Your approach here will be nutritional. Systemic integration and homeostasis, here we combat endocrine, immune, digestive and central nervous system disorders. And your approach here will be hormonal and nutritional. And then you have the total body homeostasis, where we combat mind, body, stress into relationships with exercise, diet and meditation. Okay, so this is basically, in a nutshell, what you're covering. And putting it in another representation, in the scheme of things, you can see how we interact with mind, body, stress into relationships, with exercise, diet and meditation, the hormonal therapies, and the core biochemistry looking at glycation, inflammation, antioxidant levels and methylation, and the impact that it has to the entire genome and the systemic function of the body. So ultimately we're talking about genetic plasticity. A genetic linkage to a disease does not necessarily mean that an individual will contract the disease as he or she ages. So remember that. Just because your parents have given you a particular gene does not necessarily mean you have to turn that gene on. The conditions have to be right for that gene to be switched on. And this is where the genomic testing comes in hand. It does indicate an increased risk to the disease if other modifiable factors are not controlled, such as diet, lifestyle, environment, and psychological. So here is the integration of the theories of aging. Everything from free radical damage to dysglycemia, glycation, chronic inflammation, leading on to the altered genetic structure and expression. This is overall the summary sheet of the tests that are currently available from age diagnostic laboratories, covering everything that you needed to be able to test through anti-aging medicine. You have your genomics and proteomics. Here is where we're concerned about what did you inherit. Are your bad genes awake? Switching off bad genes, suppressor genes, methylation levels, oxidative damage, telomere length, and cancer screens. Along with that, I also now want to include things such as inflammation markers and triggers through a genomic level. Detoxification, this is your spring clean of your body. Liver and metabolic clearance. Liver detox, I prefer to call it metabolic clearance because I do not upset the conventional medical establishment. Especially if I'm going to talk about something like this, I'd rather throw in adequate scientific terms to slap them around into submission by saying cytochrome oxidase P450. Oh yes, we understand that one. But talk about liver detoxification and they look at you as if you've come out of the archives of naturopathy.